I'm Casey Kaler with Ability 360. Today, we're sitting down with Cy In, a staff attorney for the Arizona Center for Disability Law, talking about the COVID-19 vaccine distribution plan. So, Cy, thank you so much for joining us today. We really appreciate it.
Thank you for having me.
So, let's jump right into it. So, the letter that you wrote to the Arizona Department of Health Services, what was behind that decision?
So we were looking at it through like a historical kind of perspective, because historically individuals with disabilities have been routinely discriminated in terms of healthcare, in terms of getting access to healthcare. And after reviewing the October guidance that the Department of Health issued, we thought we needed additional protections for different groups of individuals with disabilities.
The letter was co-signed by how many other organizations?
I don't know off the top of my head, but I think we have at least 10 organizations, 10 disability rights organizations on the letter.
And one of them being Ability 360?
That's correct.
Okay. Along those same lines, what were some of the discussions that went around your guys' office, deciding to write this letter?
Sure. So our main focus was on individuals with intellectual or developmental disabilities because in many cases, this group, this subset of the population, often have underlying conditions. They might have like heart disease, higher rates of cancer, or higher rates of disabilities. So we looked at statistics from Arizona, and we looked at statistics nationwide, and we wanted to make sure that this group, among with other individuals with disabilities, were protected and were advocated for.
Kind of break it down a little bit for us. So what exactly does your letter call for specifically?
We're calling for a couple of different things. One is for explicit protections for individuals who have IDD or intellectual or developmental disabilities. So by explicit protections, I mean all individuals, regardless of where they live. So the updated guidance from the Department of Health includes individuals with IDD who live in group homes, which is a great start, but that doesn't include other individuals who may live with their families or live out in the community. So we wanted to make sure all individuals with IDD are protected. Another thing our letter explicitly asks for is for the Department of Health to partner with other disability rights organizations. And it doesn't necessarily have to be our organization, Arizona Center for Disability Law. It should be with prominent disability rights organizations like Ability 360. And the reason why we want to do this is because disability rights organizations have expertise in their respective areas. They know how to put out materials. They know how to communicate with their respective audiences. For example, the Arizona Commission for the Deaf and Hard of Hearing may have specialized ASL videos or communication materials to put out for individuals who are deaf or hard of hearing. There are plain language options for other disability rights organizations to use. So we want to be on the ground running. We want to be able to communicate with our respective organizations, not just in terms of when they'll get the vaccine, but is the vaccine safe? If I have questions about the vaccine, who should I contact? What is in the vaccine? So we want to make all that information available, and we want to partner with the Department of Health and Human Services or Department of Health to get that information out.
The letter was dated December 14th. We're now 7 days post sending the letter. Has there been any response or at least acknowledgement that the letter was received from the Department of Health Services?
There hasn't been a response yet, so we're hoping to get a response either pretty soon or after the holidays.
Okay. We're speaking directly to people who are involved in the disability community, but is there anything people can do to kind of help this letter achieve what everyone wants it to achieve?
Yeah, I think there are grassroots efforts and like local efforts individuals can take. They can talk amongst themselves within their respective organizations, disability rights organizations, to see how they can rally and get further support. They can also reach out to their representatives, their state senators and state representatives, to see whether they can communicate with the Department of Health to further things along. Or they can also write to Dr. Kara Christ or the Department of Health to expressing their concerns.
So I want to ask about one other group of people. This is a group of people that's very, very involved with the disability community, but caregivers. Does your letter seek priority for caregivers as well?
Absolutely. So caregivers are kind of the frontline support for many of these individuals. Because they're going out in the community, they're interacting in the community, possibly like getting services, going to the grocery store and doing things like that, and then they're coming into various homes and caring for individuals. So I'm sure they're taking all the precautions that they need to take, but there is still a potential risk for caregivers to contract COVID-19 as well. So we're looking at getting caregivers prioritization too.
So you briefly mentioned the procedures that were put out, I believe, in October. Can you talk a little bit more about what those procedures kind of outline and then what might be missing from those procedures?
Sure. So the October procedures were mandated by the CDC. So each state has to submit their COVID vaccination guidelines, and it's built upon years of information and years of collaboration just within the state and within other organizations and within the CDC itself. And the report itself is from my understanding, it's a working document, and there's always room for improvement, and there's always room for like amendments and additions. As far as the October report itself, what we're asking for in the letter were what we saw as disability rights related issues. So more explicit protections for individuals with IDD, their stronger protections for those who are homebound. So I failed to mention that before, but individuals who are homebound because of disability might not have access to the vaccine. So we're hoping the Department of Health find some way to be accessible to those individuals.
Final question. I know you've detailed it out, but with the letter, what's the end goal?
The end goal is greater protections and equitable health. We're ensuring that individuals with disabilities are protected from like a bioethical point of view, and that they are not forgotten. So we want to make sure that that the Department of Health looks at the guidance, looks at guidance from the CDC and other organizations, and comes up with a procedure to find an equitable vaccine distribution plan.
So Syed, thank you so much for joining us here today and for helping us kind of break down all this information for our consumers. We really appreciate it, and yeah, I think we're all fingers crossed that an acknowledgement can come soon.
I'm glad to help.
And for those of you watching at home, thanks for being here.